Lately, it feels like everywhere you look, dentists are talking about the connection between oral health and overall health. If you scroll through Instagram or LinkedIn and other social media platforms, you might think we just discovered this last year. We have known for decades that periodontal disease is linked to diabetes. We've known about inflammation and cardiovascular risk. We've known that oral bacteria can enter the bloodstream. So we take this regimen for many things that we give antibiotics to our patients with heart problems. So this is not breaking news. Why does it suddenly feel like a movement? Let me share how I see it personally. First, the science didn't suddenly change, but the strength of the evidence did. We now have better long term studies, clearer inflammatory models, more sophisticated microbiome research, better risk assessment tools, more technology, saliva analysis, blood analysis, you name it. What used to be described as possible association is now discussed as clinically relevant interaction. That's a shift also in confidence. And confidence changes communication. Second, and I think this is important, we are living longer. If you live to 90 or 100, chronic low-grade inflammation over 30 or 40 years becomes relevant. It wasn't in the past. Dentistry is no longer just about repairing teeth. It's about maintaining biological stability over many years, over decades. That's a completely different time horizon. In a longevity driven world, the mouth suddenly matters much more. And as a dentist, you might like that. Not because it's trendy, but because time magnifies risk in any health issues. Third, dentistry is repositioning itself. For a long time, we were isolated from medicine. Teeth here, body there. That separation never made biologically sense. Now we see, and I hope that we are seeing more interdisciplinary thinking, more systemic awareness, more conversations about inflammation and risk profiles. Dentists are slowly stepping into a broader healthcare role. We are like the oral health coaches. And honestly, I think that's long overdue that we are switching from the mechanics to something different. Now let's address the uncomfortable question. Is there also an economic component in all this new thinking? Of course, there is. Healthcare systems are under pressure. Restorative dentistry alone is not the future of sustainable practice. So we have to think about new ideas, new roles, prevention programs, maintenance models, risk based recalls. So these are words that you should remind of. These are medically sound and economically stable. But here's the key, talking about oral systemic health does not automatically mean someone is trying to sell fear. It can also mean the profession is evolving. And this is what we want. We just have to be careful how we communicate it. And yes, social media amplifies everything. Big claims travel fast. Your gums control your heart. Your mouth is the root of disease. That creates clicks. But biology is more nuanced than that. So you have to be careful not to jump into the myth trap. The mouth is part of the body. Inflammation is interconnected. Risk accumulates over time, but no drama, just physiology. So let me tell you where I stand. This is not a hype, but it's also not magic. The oral systemic connection is reality. It's biologically logical and it becomes more relevant in a longevity society. With that relevance comes responsibility. If we position ourselves as oral physicians or oral health coaches, we must communicate with precision, not exaggeration. We cannot oversell biology just because prevention sounds attractive. And to my patients watching this conversation is not about fear. It's about long-term thinking. It's about reducing risk early instead of managing complications later. The mouth is not separate from the body, but it is also not the single cause of everything. The truth sits in the middle. I'm curious. Do you feel this conversation is driven more by stronger science, social media dynamics, or economic shifts in healthcare? And where should dentistry position itself in the next 10 years? Let's discuss this. I'm really looking forward to your feedback on this very interesting topic. See you soon.